Hello, I'm Will Haynes of the Watkins Museum of History, and I'd like to welcome you all to our special program about Lawrence and the 1918 flu pandemic. Before we begin, I'd like to note that this program is in connection with our upcoming exhibit, Lawrence Memorial Hospital, A Century of Care. So if you're in the Lawrence area, you'll want to drop by and view this exhibit when it debuts after Thanksgiving. For today's event, we're hosting Dr. Katie Foss, Professor of Journalism and Strategic Media at Middle Tennessee State University. Hello, Katie.
Hi, thanks for having me.
It's totally our pleasure. We're happy to have you here to speak with us. So Katie has written an absolutely fascinating and unique book, and I have it here, Constructing the Outbreak, Epidemics in Media and Collective Memory. I encourage you all to pick up the book through our friends at the Raven Bookstore here in Lawrence, Kansas. You can go to ravenbookstore.com and do a title search to get the book. So, Katie, are you ready to dive back into 1918 Lawrence?
I am, and in fact, I wish I could go to your exhibit because it sounds fascinating.
Well, I really think it will be, and I encourage everyone in the area to come in and view it. Of course, Lawrence Memorial Hospital was not opened yet by the time of the pandemic in 1918, but certainly this public health crisis spurred the creation of that institution. So, and it has a long and a rich history for the past 100 years. So, yeah, by all means, everybody who's able to, we hope to see you here to come in and view that exhibit after it debuts after Thanksgiving. So, in your introduction, Katie, you explain, quote, "This is a book about fear, stigma, othering, power, discrimination, colonization, and things done in the name of science," unquote. So could you elaborate for our audience what the book is about and what inspired you to tackle this topic?
Sure. I'll actually start with the latter question. So a number of years ago, I read a wonderful historical fiction, which was Laurie Halse Anderson's Fever, 1793, all about the yellow fever outbreak in 1793 in Philadelphia, as told through this fictional story of a young girl. But I was fascinated with Anderson's use of primary sources and how she wove those through this fictional story. And it really got me thinking about the primary sources that are available to study these different moments in history. I've always been fascinated with disease. I teach health communication and study health communication. So I really saw this as an opportunity to look back at these different moments and to better understand what happened, or at least what was constructed as happening, because as we know, not everybody's story is told in an epidemic. But just like look at these moments through this lens of the function and kind of interplay between media and government response and the public's attitude and what they're doing, as well as look at kind of other primary sources that tell kind of a different story of these moments, like looking at diaries and other things that have been preserved. I've always, of course, been interested in this. And then it was difficult to choose which epidemics. I will say that trying to figure out, okay, there have been so many epidemics. I mean, history is shaped by outbreaks, epidemics, and pandemics. And certainly that's true for the United States. And I wanted to focus on the US. So trying to figure out which ones was a challenge. And I ultimately decided, based on other stories or other things that were happening in that time, to try to tell the kind of the whole picture of these different kind of glances at history.
Well, it's really interesting to hear how you decided to choose the case studies that you would talk about. Yeah, I appreciate getting that detail. So let's narrow our focus to Lawrence in 1918. What were the origins of the so-called Spanish flu, and how is Lawrence important to in the story of this pandemic?
Well, first of all, it's heavily debated. It's been studied for years, and there's not conclusive evidence as to exactly what the origins are for influenza 1918, 1919, because influenza and pneumonia existed before that point. And that's what makes it really difficult. So it certainly wasn't an a new disease at that time. And it wasn't even considered necessarily a dangerous disease before 1918. So it wasn't heavily documented in public health reports and other means of documentation in that moment. Instead, it really had to be to kind of discern or to kind of decipher this moment. I use a lot of secondary sources and had some help with other people that have investigated this as well, including journalist Peter Grant. So it was really interesting that he had an article as part of his blog online that suggested that John Barry's determination that it was Kansas, but a different part of Kansas, might not be the actual case. And so that got me into looking at various news sources in Kansas, stretching back into 1918 or 1917 to look at, okay, where did we really start to see a rise in pneumonia and influenza together? Because that's really the secret to figuring out this moment, is looking at those two together. And there's a few cases in January 1919, but it's not really written about as something that's dangerous or even at an outbreak level until March. And that's at Camp Funston in Fort Riley, Kansas, at the beginning of March. A number of cases, actually a lot, over 1,000 cases at Camp Funston. And then by the end or mid to end of March at the Haskell Institute in Lawrence, Kansas, there are documented cases, as told not only in the newspaper, but as well as in public health reports. So that really is the first civilian set of cases, at least that I could find and that other scholars have determined at that point. So a long time before it reached Spain, it was influenza, pneumonia, what would become this pandemic, was in Kansas, particularly Lawrence. And that's why I chose to study Lawrence.
And you mentioned that it hit Lawrence long before it reached Spain. Now, isn't the reason why it's called the Spanish flu related to media in Spain?
Absolutely. And I should note that, yes, it was called the Spanish flu in the United States, but it had a lot of different loaded names or equally loaded names, depending on where you were in the world, and placing blame on other places or trying to distance the Spanish flu or influenza pandemic from their own location. So we think about the Spanish flu as occurring in multiple waves, but because of the lack of media coverage for that spring 1918 wave, there really wasn't a lot of public knowledge that this was even happening in the first wave. That there really wasn't knowledge of this happening until there started to be news coverage of outbreaks and epidemics of influenza in China, Morocco, India, and then on to Spain and the UK and countries before reaching the United States again for the second time, but presented as the first time in August, but especially in September in 1918.
Yeah. So, as you explained in the book, and you alluded to that a little bit a few minutes ago, influenza has been a constant threat to human beings for centuries. So what factors made the 1918 strain particularly virulent and deadly? And what kinds of people were most affected by the so-called Spanish flu?
Right. So a number of factors came together to make this a really deadly moment. First of all, this type of influenza and combined with a deadly strain of pneumonia, I mean, they went hand in hand, and you can't take away the pneumonia without the influenza for it being a deadly moment, affected young adults more than previous strains and strains since then of influenza. So especially the ages 15 to 40, which that's really uncommon for disease to hit hardest in the young, healthy adults, as opposed to the very young and the very old. And that was one of the reasons, combined with the moment that it was World War I, and you had all these soldiers being moved around and being moved overseas and back who were transmitting the virus, combined with a lack of understanding about what a virus could be and what was happening as well. And then as far as typically affected, again, young adults, which is really rare. And I mean, it's just a strain that mutated to affect this age group in a way that had not been seen before.
Yeah, and I imagine that must have been especially frightening for people to see, like, what had been young, healthy adults come down with this deadly, in many cases, deadly condition.
And especially soldiers.
Yeah.
So all those soldiers who never even made it into battle because they died before they even, some died before they left US soil, died
Mhm.
on the ships going overseas. And that's written a lot about by mothers of soldiers who died
Oh,
in the Kansas archive, which is another reason why I selected Lawrence, Kansas, is because of the wonderful digital archives
yeah.
for Kansas and for Lawrence included.
Excellent. Yeah. Yeah. Our resources for studying Kansas history are pretty great
Mhm.
here in the state. But it's really good to know that that was another reason why you
Mhm.
chose to write about Lawrence for the 1918 pandemic. Uh, so your chapter on Lawrence, actually, I jumped ahead of myself. I have a really good question here that I want to make sure we get to. You mentioned how the disease hit Lawrence and specifically Haskell Institute in late March of 1918.
Mhm.
And so when the disease first hit Lawrence, how did residents react? And of course, the reactions changed as it
Mhm.
became worse in the fall. But how did residents react, and what communities of people were most affected by it?
Mhm. So first, I would separate out the two moments because there were a few news stories on the outbreaks at Camp Funston as well as at the Haskell Institute and some at the University of Kansas. And those were treated as isolated incidents just covered in local papers in their moments in March and April of 1918. Now, when the virus circulated the globe and came back to primarily Boston in September 1918, the Kansas papers, the Lawrence papers, treated it still as a distant threat,
Mm,
something that we're not going to worry about too much because that's not here, especially before it hit Boston. It really changed once cases emerged in Kansas.
mhm.
At first, Kansas City, Missouri, and then in Kansas to kind of don't worry about this threat to here's what you have to do to protect yourself. You should know that this is something that we're familiar with. This is the flu, but here's what you can do. And you see that kind of alarmist discourse rise as cases rose, which makes a lot of sense, particularly when the University of Kansas started to have cases and the university was shut down then and students were
Yeah.
quarantined on campus. And then again, anybody who can volunteer should. It's time to make pajamas for the pajama drive to help those who are ill. Soldiers are going to do their duty. Student Army Training Course members are going to do their duty again, doing drills and collecting cigarettes for their sick friends in the hospital.
To show they really care. Yeah, exactly.
Absolutely. And there's this attitude that everybody needs to chip in and do their part, do their patriotic duty as part of the war effort
Mhm.
by following these different mitigation strategies of quarantine, but also volunteering to help care for the ill.
That's excellent. Yeah, I love that fact that you included in the chapter on Lawrence that uh, the Lawrence chapter of the Red Cross participated in that national drive and called for specifically for 240 pairs of pajamas to be sewn and distributed, not just in Lawrence, but across the country.
Yes. And
So,
before there was Target, there was
yeah,
pajama
exactly.
drives by the Red Cross.
That's great. Yeah. So, now, speaking about how different groups of people were affected and how people responded to the pandemic,
Mhm.
uh, your chapter on Lawrence goes into some interesting detail on about how the news media and the authorities targeted male and female University of Kansas students with different
Mhm.
messages. Could
Mhm.
you talk a little bit about why that was and who the how the male and the female students were affected in different ways?
Sure. So the messages were heavily gendered, in which male students were upheld as these heroes, primarily because they
Mhm.
were in that student army training corps group. So they were busy doing drills and they were isolated from the rest of the campus. Whereas the women, many of them left, and I'm sure that it wasn't all women, but the way that it was framed was that it was what the female students were breaking quarantine by going home to their hometowns.
Hmm.
And in order to combat that, the university started offering weenie roasts and hikes of groups up to 20 people so that you won't break quarantine because you're going on these hikes on campus. And they also kept the library open just for picking up books. But I have to imagine, especially looking at our students now and how everybody's responded over the last 18 months, that I can't even imagine how scared and bored all these students were, especially without the
Yeah.
drills of the Student Army Corps and without the buddies and kind of structure of that, to just be sitting around with no classes, with nothing to do, with no way to contact your family to see if they're sick, if they're okay, what's going on, you could write letters, but that's it. I mean, I can't even imagine being in that moment. And so even though, again, the heavily gendered discourse blames the female students for fleeing to their homes, we can kind of understand it, especially from a contemporary perspective.
Definitely. So, how did so could you talk a little bit more specifically about how the media's behavior nationally and locally, what that tells us about the role of media and popular narratives in times of epidemic? So I'm drawing back a little bit from this local story of Lawrence in 1918. I mean, you wrote about it not just for the fascinating stories, but also because it tells us something about how the media can shape collective narratives. So could you talk more about how 1918 Lawrence fits into those patterns?
Absolutely. Well, and the biggest difference between then and now, and I can talk more about the parallels later, the biggest difference is that back then, news content was so localized, so that we think about the Spanish flu as the pandemic, but they weren't using that word so much back then. It was very focused on when it comes to your town, or if it comes to your town, and how is the town responding. So whereas the pandemic went on for over a year, it really feels like this moment in Lawrence and similar places across the United States was pretty contained to a little bit over about a month and a half. That we see the typical pattern of epidemic coverage emerge, where at first it's downplayed, you're not at risk, you don't have to worry. Then it escalates to a state of alarm in which everybody should either volunteer or stay in their houses, in which you need more undertakers and you need more coffins, and they're short staffed at the post office, and we see makeshift hospitals, to a point where all of a sudden it starts to dwindle. A lot of times, even before cases start to go down, in which, oh, wait a minute, by Halloween, and they shut down the campus in early October, by Halloween, okay, the town can start thinking about reopening. And across the local papers, they start talking about Halloween celebrations, to that moment where, okay, this has subsided, even if there's still hospital patients, it's subsided. And again, that's not unique to Lawrence. It's more unique to kind of the technology available at that time, until we reach an era in which you have a lot of national and international coverage. Technological wise, we really don't see beyond kind of that local perspective. But on the bright side, a local perspective is really effective in motivating people to take action, and sometimes being that action being quarantine as well. And especially connecting that with doing your duty, helping your community, messages like that, right alongside stories of people that people knew that were sick, or people that were dying or had died, or families that were mourning. And that's a really effective set of persuasive strategies, primarily when there weren't that many news outlets to choose from, so that people are reading these stories.
Interesting. So, like, this question is a little bit off the cuff, so I apologize for that a little bit. But it was really interesting to see how, in some cases, the media nationally and locally downplayed the pandemic or ignored it because they didn't think it was actually as dangerous as it turned out to be. But in other cases, they really cast, obeying the rules for public health as citizens' patriotic duty. There was that. How did the rhyme go? The Kaiser. It's the title of your chapter. The Kaiser laughs when you spread disease, so stop the coughs and cover the sneeze. Right.
That was one of my favorite discoveries, was finding that message, which was repeated a lot.
I can imagine. Yeah.
Yes.
So, do you think that the media failed in taking the situation seriously and failed in its duty to inform the public, or do you think it caught up and it did a good role or a good job of getting the message out about public health?
Well, first I'd take a step back and say, I can't generalize and say the media, since that encompasses so many different outlets and different levels for different audiences in different places. So I would say overall, I don't think that I could say that media outlets failed, because they use the resources that they had. Reporters use the resources that they had in that particular moment. And in fact, I would say that any media outlet, local or national, that makes it through an epidemic or a pandemic should be applauded. Because many newspapers don't make it, or they shut down temporarily because it's just that hard to keep a paper going under the duress of an epidemic. Sometimes because you're short-staffed, because people are sick or they've died. The journalism department was affected at the University of Kansas during influenza. So I don't think it's that as much as when you have these competing discourses, especially with war, right? It's really hard to juggle what's supposed to be most salient at any particular moment. That said, I do think that we failed in preserving this moment in collective memory. I think we failed in preserving it in history books or in social studies curricula when we really talk about this moment. It's World War I a little bit, and then you skip to World War II, or you skip to the Great Depression, and its impact was tremendous and continues to be tremendous. So these are stories that need to be told and haven't been told adequately.
Absolutely. And could we dive into that a little bit more specifically? You mentioned how the story of the pandemic was not told for a long time. And that's one area in which we failed collectively as a society. So why do you think it is that this? Because I'm aware of this on a less of a level than you are, but I also have heard about how for a long time, and I thought it was really bizarre too, this devastating disease that struck much of the world, including the United States, was just largely forgotten about, or so it seemed in later decades. Why do you think that was?
Well, I think it got overshadowed by the war ending, and that's a big part, especially because of the timing, right? And here they're celebrating on November 11th, 1918. Woohoo, the war is over. And then just rushing to forget a really horrible time, and instead focusing on moving forward. And we think about the roaring 20s, right? And how you want to move forward and come out of that moment. And then I think influenza is also a difficult disease to capture in popular culture. It doesn't have the visual spectacle of something like smallpox. It's not as easy to capture with like polio and different devices that people sometimes had to use, like mobility devices. It's hard to tell, and also it gets downplayed because we're still familiar with influenza, or people sometimes a lot dismiss, oh, it's just the flu. So all those factors, I think, contribute to its moment, as well as the disease itself. Not as much as diphtheria, though. Diphtheria was really has been written out, despite it killing so many children and still existing today.
And that is a story that people can also read about in your book. There's a chapter about diphtheria in Nome, Alaska. Is that correct?
Yes. And that has been captured only in the story of Balto, that sled dog, is really all that we hear about that.
But there's much more to that story than just Balto, definitely.
Yes.
Yeah. So, Katie, I would like to ask you, so what implications does the story of influenza and how it affected Lawrence in 1918 have, and really the devastation of the pandemic in global terms in 1918? What implications or what lessons could that provide us for the 21st century and our own current health crisis of COVID-19, and of course going forward with the fallout of climate change and everything else? I mean, we're certainly going to be hit with future pandemics. Does this devastating outbreak in 1918 have any lessons to teach us about how we can handle these things going forward?
So I've studied these comparisons since the beginning of this pandemic, and I've seen a lot of popular articles try to make a lot of arguments and kind of pull things ahistorically and use to justify different moments of this pandemic. And I want to say that's problematic for a number of reasons. One being it was a very, very different time. There was a lack of understanding in terms of what even scientific evidence was available. But what I think we can pull from that moment is just that more than anything, people got past it. They did. And while we don't want to forget about that moment or this moment, they did come out of it. That there was certainly a transitional time, which was not written about much and wasn't really covered. But at least those who survived did move forward and do things like build new hospitals and continue on with their lives. I think that's the biggest lesson. And also, even with the lack of knowledge they had back then, they still understood quarantine and the importance of keeping sick people home and keeping things closed when they needed to be, and all of that. So some of those strategies as well. And I would say that the biggest use of the past for justification has been with mask wearing, and that doesn't fit. That's actually become kind of a sore spot for me, just because mask wearing, while it happened in influenza 1918, 1919, it didn't happen in the initial phase. It was actually a little bit later, and it didn't happen everywhere. It wasn't a universal thing. It was by kind of local ordinances, and it depended on what your town said for whom, for how long. Was it children or just adults? Was it just on the streetcar? Was it just the barber? Was it only nurses? So there were a lot of different rules within that, and for a pretty short period of time. But that was more headed towards 1919. It's kind of after the quarantine period. So there's a lot of ahistorical photos, like of people, watching sports while wearing masks. Well, that happened a little bit at a few times. I don't exactly know how many times, how many games were played. What that ignores is that most sports were canceled because of World War I in the fall of 1918.
Oh, yeah.
All right. So it doesn't quite work. It doesn't work, as you know, to take these moments in the past and say this is how it was then and how it should be now, because it doesn't contextualize the moment. So it's amazing to read about the experiences of the past. I think we need to preserve it and learn from it. But what we learn needs to be contextualized for our own moment here in 2021.
You're right. And I totally agree. There's such an urge, not just among lay people, but among professional historians, to try and read backward and see where things fit in, and like, aha, this incident in the past helps me make my argument about how we should behave today. And you're right. History is messy, and it doesn't often work out that way.
No, it doesn't. Or I think about like those students, like I said, the women who are blamed for wanting to break quarantine to see their families. I can't even imagine students being quarantined in a dorm or in their place of housing and not having phones or internet, or having your online classes, or having any way to check on your family to make sure that they're still alive. It's just such a different time period. I also can't imagine the universities asking the female professors to care for the sick and wash their clothes and feed them, which was another point that was almost completely written out of the University of Kansas, that save for a graduate magazine that had alumni magazine that had one article on it. It wasn't covered in any of the newspapers, including the campus newspaper, nor was it covered in the Jayhawker of 1919, which I bought the yearbook from that time. So there's almost nothing in here about influenza at all.
So there's almost nothing in the yearbook about influenza. And why do you think they left it out of the yearbook?
Well, I think it was, again, it's very focused on soldiers that were lost. And then there's one page that mentions the football season being delayed. But I think that it was written out of history because perhaps they didn't want to remember it. I don't know exactly. I mean, we'll never know, because unfortunately they didn't write, this is why we left out this huge thing that killed so many people last year. But in that, it's significant. They also don't address other things that, other even kind of the diversity of the student body, for example, compared to some external sources that suggest that it was more diverse than the yearbook shows. So I guess that for this moment, and perhaps for other yearbooks capturing this time, and even now, it kind of told the history or captured the moment as they wanted to, not as what was really happening. I mean, kind of the Facebook of 1919. Yeah.
Yeah. Well, that's very interesting. And I was going to ask something else. So was a vaccine ever developed for the 1918 strain of the flu?
Yes and no. So
Okay.
yes, there was a vaccine, and it was called a vaccine, and it was given to some soldiers, but it wouldn't have protected against this influenza
Hmm.
pneumonia combination. I believe it was actually for the pneumonia, because they didn't understand what it really was that was making people sick. So it's a that's another part that's very, very, very different than to the decades of research that went into our current very effective vaccines.
Yeah. Yeah. Hmm. That's
And there weren't like
unfortunate.
trials done or anything, or blinded studies or anything. It was just, here's a vaccine, give it to the soldiers. Uh,
Yeah. Yeah. Hmm. And
yeah.
they didn't have any. They weren't able to refuse it either, being soldiers, certainly. So
No, and
there's
nobody
probably
would
less
have in
pushback.
that point. I mean, people
Yeah.
were so grateful overall for vaccines, the effective vaccines that they had at that moment,
Hmm.
which was, the typhoid vaccine, for example, and certainly
Mm.
smallpox, that it really wasn't something. And if they had, it wouldn't have been covered. And so that kind of resistance to public health or resistance to scientific thinking was not something that would have made it through the gatekeepers of most media outlets. Now, there's like one kind of anti-masker photo from San
Mm.
Francisco that was widely circulated last year, but that doesn't reflect what most people or most media outlets were covering in that moment.
I see. So could you elaborate on that? Does that mean that simply that the media were not covering anti-mask protests, or that there were not a lot of anti-mask protests?
There likely were not very many.
Okay.
And especially when you have, again, this rise of the scientific paradigm in which people are celebrating the advancements of science,
Yeah.
combined with the parallels between the wearing the gauze mask made by the Red Cross and wearing a gas mask overseas for the soldiers. I mean, there are just so many reasons why people wouldn't have resisted in that moment
Hmm.
in the same way. I mean, we'll never know exactly because it wasn't covered,
Yeah.
but it's a very different time. And again, it was so very localized as well.
Hmm. Interesting. Yeah. So certainly localized for those poor students that were quarantined in their dorm rooms, and or forced to or strongly encouraged if they were female to help the sick uh,
Mhm,
at the school. Yeah.
mhm.
So Katie, do you have anything else you would like to add about this story of the 1918 pandemic, or anything else from the other pandemics and outbreaks
Sure.
that you talk about in the book?
Just, again, this is contextualized because of the war. I
Hmm.
wish that the German language newspaper, and I don't speak German, so it would have had to be translated, but I wish that that had been able to be continued printing
Oh.
during the influenza pandemic. So it ceased publication because of the censorship in the war in
Mm.
August of 1918. I also wish of course, for all the different stories that I tell in my book, that we had more diversity and inclusivity of voices of all the different
Mm.
people who really were experiencing these things, which we don't. We're only, at the mercy of what was covered, who was writing, who was publishing, and what was
Mm.
preserved, which is unfortunate.
Yeah, that reminds me that in the book you mentioned that Lawrence had 13,456 people in 1918,
Mhm,
including 2,600 African Americans.
mhm,
And those of us well versed in Lawrence history know that from the beginning, there has been a substantial black population.
mhm,
But it sounds like you're saying, and I did see this in the chapter as well,
mhm.
that their stories are some of those stories that were not nearly as well preserved. So unfortunately,
Right.
we do get that skewed picture
Mhm.
of what happened during the pandemic.
Yeah, only little glimpses if
Mhm.
race was mentioned in, for example, some of the obituaries or the stories of people who were ill.
Yeah, and um, even though the first civilian outbreak, your research indicated, was apparently at Haskell Institute, it seems like we don't have much of a story of how it affected
Mhm.
the population at Haskell either.
No, I know, and I wonder if I'd have gotten more coverage if it hadn't been at a place for Indigenous people.
Yeah.
And I'm happy that they had a newspaper and they still have the newspaper, and it's
Mm.
available, and so I could read their newspaper. But even those experiences that they had six physicians, that there was an outbreak big enough and important enough to bring in 6 outside physicians to consult and compare it to Camp Hudson is really interesting. And I wish I had more documentation of that so that I could, even those experiences like of being a student and having these physicians, this team walk in and you're like, okay, this is just the flu, or is it because these people are here to inspect us? I mean, again, just there was a lot of speculation just in my head and just kind of pondering a lot of these moments throughout my book.
Yeah. Well, it's an excellent book. Again, it's Constructing the Outbreak, Epidemics in Media and Collective Memory. And I know that I certainly will be thinking more about how the news that I'm getting about COVID-19 or about other diseases through history, thinking about how that was shaped by the media at the time and how it helped craft these narratives that people absorbed. So it's a really unique book, and I encourage everyone to pick it up. And we hope that you do so by going to ravenbookstore.com, our friends at the Raven Bookstore here in Lawrence. So, Katie, thank you so much for taking time from your busy teaching and research schedule to speak with us tonight about this fascinating history.
Thank you for having me. I'm so glad. I've wanted to tell this story because, again, I really fell in love with Lawrence in reading this, or at least 1918 Lawrence, since I haven't been to 2021 Lawrence, and the impact on the town and just how the university works within a town. And I thought about this a lot early in the lockdown, and in fact, wrote a number of blog posts just kind of reflecting on the parallels at the time, just to this moment, especially as the university shut down, and how does that work, and what do people do, and what was this like?
Yeah, well, like a lot of people, I mean, you fell in love with Lawrence learning about it, and a lot of people who read about Lawrence or come here do so as well. We have a fascinating history, and it was really interesting to learn how our history shaped your research into the power of media during outbreaks. So with that, I would just like to thank you again for joining us tonight. And thanks to everybody who tuned in tonight. And I will let you know that if you were unable to, or if you have friends who are unable to join us for this live program, the video will be up on the Watkins Museum YouTube page and on our Facebook site. So with that, thank you, everybody, and we'll see you next time.
Okay, thank you.
Thank you.